Good afternoon. Today is Monday, May 4th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Our guests today are Dr. Christina Lipke, Medical Director of the Oswego County Health Department, and Diane Oldenburg, Senior Public Health Educator. There's been a lot of discussion lately about the antibody testing for coronavirus. We invited Dr. Lipke today to explain the different types of tests and tell us about how the State Department of Health is arranging for tests and using that information. It's still as important as ever for us to practice social distancing. We learned yesterday that a potential community transmission occurred recently at a store in Fulton. An employee of the Fulton Dollar Tree tested positive, and members of the public have possibly been exposed. Fortunately, the employee was wearing a face mask while working in the store, which will help prevent the spread of the virus. If you shopped at the store between April 24th and April 30th, you should watch for symptoms of COVID-19. There is additional information about this on the Health Department's COVID-19 page. It is a reminder for all of us that COVID-19 is still active in Oswego County, and we all need to do our part to help reduce the spread and limit our chance of exposure. Next, I will call on Diane Oldenburg to provide today's COVID-19 report. Diane?
Thank you, Mr. Chairman. For today's COVID-19 report, we have 1,823 residents that have been tested or are scheduled to be tested. We've had 66 residents test positive for COVID-19. We've received 1,682 negative reports back for testing for COVID-19, and we have 69 reports still pending. Currently, we have 56 patients that have recovered from COVID-19, and we have 3 deaths in the county related to COVID-19. Currently, 64 residents are on precautionary quarantine, and we have 68 residents on mandatory isolation or quarantine. To date, 1,878 residents have completed monitoring for COVID-19 and have been released for monitoring. Thanks.
Thank you, Diane. It's great to hear that we continue to make progress. More and more people are recovering, and the number of active cases remains relatively low. At the same time, the number of people who are released from monitoring continues to increase. That is all good news, and as I said earlier, it is a direct result of people practicing social distancing and staying home as much as possible. And now Dr. Lipke will give us information about the antibody testing process.
Thank you, Chairman Weatherup. There have been a lot of questions about testing for COVID-19. Right now, there are 2 main tests that are being discussed in the media. One is called the PCR test, and that looks for the actual virus. This is the test that most people are familiar with. This is the test that should be used when people are actually sick. The other main test that is being talked about a lot more lately is antibody testing. And simply put, the antibody tests look for your body's response to the virus. There are literally over 150 antibody tests on the market, and none are truly FDA approved or reviewed. A handful have what they call emergency use authorization by the FDA. This is referred to as EUA, meaning the FDA has reviewed the manufacturer's validation studies and granted emergency use authorization. Those handful of antibody tests that have that designation are extremely hard to get. Antibody tests are done on blood sample and should not be done when a person is sick. Generally, they take anywhere from a few days to a few weeks to become positive once a person is exposed to the virus that causes COVID-19. It really depends on the type of antibody that is being tested. Because they take so long to become positive and because they are not testing for the actual virus, these tests do not tell us if somebody is contagious. So if you are positive on your antibody test, you will not be quarantined. While we think that these antibody tests should remain positive for at least a few months after a person has had an exposure or been sick from that virus that causes COVID-19, the truth is that we don't know this for sure because the studies just have not been done yet. The scariest thing about these tests is that there is a risk of false positive. When someone is sick with a different type of coronavirus that causes like the common cold, some of these antibody tests may show a false positive result. And lastly, it's important to know that if you have antibodies to the virus that causes COVID-19, that does not necessarily mean that you are immune. So please, even if you have an antibody test and it is positive, remember to take the same precautions you would have before you had the test. Despite all this, there are reasons for us to look at antibody testing. From a public health perspective, doing antibody testing on large groups of people, like the state health department did last week, can give us an idea of what is going on in our county and state. Also, there are a lot of ongoing studies looking at plasma donation from people who have recovered from COVID-19, and they are using their plasma for patients who are currently sick. If you have antibodies to the virus that causes COVID-19, you can apply online to the Red Cross or the New York Blood Center to become a plasma donor. One last note on antibody testing. Currently, the best person to ask for more information on antibody testing is your own healthcare provider. Antibody testing should be ordered by your own provider who can review those results with you and some of the things that we just discussed. Oswego County Health Department will be soon updating the way we report on COVID-19 to include antibody positive results.
Thank you, Dr. Lipke. On behalf of the county legislator, I want to thank you for your guidance during these challenging times. Thank you to our county residents for continuing to do your part to help stop the spread of COVID-19. We're getting through this together.